You are in good hands here with the orthopedics department at Hennepin Healthcare. From the nursing staff, surgeons, advanced practice providers, therapists, and beyond, our team has a wealth of knowledge and experience, and we thank you for entrusting us with your orthopedic care. We are confident that you are on the road to full recovery, and we are excited to be on this journey with you. In this video series, we will talk through getting prepared for surgery, what the hospital stay will be like, some details about anesthesia, physical and occupational therapy, as well as what to expect in the days, weeks, months, and even years following your surgery. Through years of research, we as an orthopedic community have learned that preoperative education for major surgeries, including videos like these, improve surgical outcomes and put patients' minds at ease. So we thank you for actively participating in your care. Preparation is one of the most important aspects of having a good outcome and a smooth postoperative course. You will need to see your primary care provider within 30 days of surgery for what is called a preoperative history and physical. You will also need to confirm that your insurance is up to date and that Hennepin Healthcare is in network. If you do not have insurance, you can work with our financial counseling department to make payment arrangements before surgery. It is important to be in your best possible state of health. If you have diabetes, make sure that you have good blood sugar control. The highest acceptable A1C is 7.5. However, below 7 is even better to reduce the risk of infection and other complications. If you smoke, you will need to quit smoking. Please work with your primary care provider to work on nicotine replacement therapy if you need it. We want you to be smoke-free for at least 6 weeks before surgery and remain smoke-free for at least 6 weeks after. This gives you the best chance to heal your surgical incision without complication. Your dentist will need to give you a clean bill of health for your mouth. Similar to blood sugar control, having a clean mouth is an important way to limit infection risk after joint replacement surgery. If you have a history of heart disease, heart attack, or stroke, please work with your cardiologist and/or your primary care provider to ensure that you are healthy enough for surgery. This may include extra tests before surgery. You can take certain medications leading up to surgery, and you may even be instructed to take medications on the day of your surgery, like certain blood pressure medications. Other medications will need to be stopped 1 week prior to your surgery date, such as ibuprofen, naproxen, or Aleve, or other similar anti-inflammatory medications, as well as GLP-1 agonists like Ozempic, Trulicity, Wegovy, or similar weight loss drugs. You will discuss how to take your medications in more detail with your primary care provider during your preoperative history and physical. At your preoperative visit with your surgical team, you will be given 2 packs of skin cleaning wipes. The night before surgery, you will use 1 pack of skin wipes on your operative leg, and in the morning of surgery, you will use the 2nd pack of skin wipes. Please do not shave your leg on the operative site. We will remove any hair if needed on the day of surgery. Also at your preoperative visit with your surgical team, we will help you determine if you need a raised toilet seat or a shower chair to use after your total joint surgery. A reacher or a grabber and sock aids, which help you put socks on your feet without having to bend over too far, are also commonly used items after this surgery. All of these items can be found online or can be picked up at a local medical supply company. Please note that most of the time these items are not covered by insurance and you may have to pay out of pocket. One of the ways that you can accelerate your recovery after surgery is to make sure that you are as strong and as in shape as possible. If needed, you can see a physical therapist in the months leading up to your surgery to learn some of the exercises to help you prepare for the exercises you will do after surgery. It is never too early to start your hip or knee exercises. Separate videos for recommended exercises prior to surgery are next in this video series. Lastly, it is very important not to eat or drink anything after midnight the night before surgery. This will delay and/or cancel your surgery. If you have a cane or a walker, you can bring it with you. If needed, our physical therapy team can adjust it to your height appropriately. If you do not have a walker or a cane, we will order one for you before you leave the hospital if needed. If you need to wear a CPAP at night to help you sleep, please bring that with you as well. Wear comfortable, loose-fitting clothing. After surgery, you will need to allow room for swelling and for postoperative dressing changes. Further, it will be much easier to get dressed with loose-fitting clothing as your mobility will be affected early on. Ask friends or family to be around to help for 5 to 7 days after surgery. They don't need to be waiting on you 24/7, but it is helpful to have someone check in on you to help you with meal preparation, fetching ice and medications, and help you with more difficult tasks in the early days. It is important to arrange a safe and reliable ride to and from the hospital. At home, prepare or freeze meals, pick up the home to limit fall risk after surgery, be sure to have cleared walkways that will accommodate a walker, find arrangements for your pets, place commonly used items within easy reach, etc. Having a living space that is prepared for you will make your life much easier after you go home.